focused on Taenia solium, including disease manifestations, transmission routes, and treatment. The third question includes treatment options with detailed explanations. Question 1. A 27-year-old man presents to the emergency department with new onset seizures. He recently returned from visiting family in rural Mexico. MRI of the brain reveals multiple cystic lesions with surrounding edema. His stool test is negative for ova or parasites. What is the most likely diagnosis? A neurocysticercosis due to Taenia solium, B. toxoplasmosis, C. hydatid disease due to Echinococcus granulosis, D. cysticercosis due to Taenia saginata, E. tuberculoma. A. Neurocysticercosis due to Taenia solium. Explanation. Neurocysticercosis is caused by ingestion of eggs from Taenia solium via food contaminated with human feces, not by eating pork. Classic in patients from Latin America, presents with cystic CNS lesions and seizures. Why not the others? B. toxoplasmosis, seen in immunocompromised patients HIV, typically with ring-enhancing lesions, not cystic. C. hydatid disease, causes large cysts in liver lungs, not multiple small brain cysts. D. Taenia saginata, does not cause cysticercosis. E. tuberculoma, can mimic neurocysticercosis, but typically has caseating granulomas and other TB signs. Question 2. A 35-year-old woman presents with abdominal discomfort and mild diarrhea. She reports a recent trip to a rural area where she consumed undercooked pork. Stool examination reveals proglottids consistent with a tapeworm. What is the most likely cause of her symptoms? A. Taenia saginata, B. Taenia solium, C. Diphyllobothrium latum, D. Ascaris lumbricoides, E. Enterobius vermicularis. Taenia solium. Explanation: ingestion of larvae encysted in undercooked pork leads to intestinal tapeworm due to Taenia solium. T. solium and T. saginata both cause intestinal disease, but only T. solium can cause cysticercosis via egg ingestion. Why not the others? A. T. saginata, acquired from undercooked beef, not pork. C. D. latum, from raw fish, causes B12 deficiency. D. ascaris, causes intestinal obstruction, not tapeworm. E. enterobius, pinworm, causes perianal itching, not tapeworm symptoms. Question 3, treatment focused. A 30-year-old male with a history of travel to Central America presents with seizures. Brain imaging shows multiple cystic lesions with surrounding edema. Serology confirms the diagnosis of neurocysticercosis. What is the most appropriate treatment? A. Mebendazole only. B. Praziquantel only. C. Albendazole with corticosteroids. D. Metronidazole with pyrimethamine. E. Ivermectin. Correct answer C. Albendazole with corticosteroids. Explanation. Albendazole is the treatment of choice for neurocysticercosis, often given with corticosteroids to reduce inflammation during cyst die-off. Praziquantel is used for intestinal T. solium, not neurocysticercosis. Why not the others? A. Mebendazole, not used for Taenia infections. B. Praziquantel only, effective for intestinal tapeworm, not for neurocysticercosis. D. Metronidazole pyrimethamine, used for toxoplasmosis, not helminths. E. Ivermectin, used for filarial infections like onchocerca, not T. solium. Let me know